Welcome to CareConnections Quick Tips. Let's take a look at how we queue an interim assessment. So your patient's been with you for a while and you want to get a status report. So we'll head to the patient and we'll right-click, just like we did for the evaluation, and select Queue Patient Assessment. Because they have an evaluation on file, it knows we don't need to do an evaluation again, and it will give you a couple of choices. You can select to re-administer the evaluation. This is rarely used, but every so often a patient might hit their upper extremity region instead of the lower or something along those lines, and you can re-administer the entire evaluation. But more frequently, you're going to do the interim assessment or discharge assessment. So at this point, we'll pick an interim assessment, and we'll select the date of their visit, and we'll determine which visit number it is. Here, we still have the opportunity to include the Fear, Avoidance, and Beliefs questionnaire if the clinician requests it. At any point after the evaluation, you have the option to include the patient satisfaction survey. If you have a drop-off problem, sometimes people will give the patient satisfaction survey a month or two into treatment to be sure they get that survey on file. And then again, because we have an email on file for this patient, we can select to email it to the patient or not. Click OK. And again, our check mark shows up in our assessment queue. We now know that we have an assessment queued for the patient. When you want to queue them up on the kiosk, at the kiosk function on a tablet, you go over to the patient assessment queue, and here, jointly with their date of birth, you have their 4-letter code, and you can head over to your tablet and log them in. It will give them the same set of questions that they took the last time. If they did get some extra questions because we weren't sure what body region it was, those are now no longer needed because the clinician has given a diagnosis. Remember, if you ever have any questions, you can always email us at support@careconnections.com.